Donning personal protective equipment. Gather the required PPE, which includes an isolation gown, gloves, mask or respirator, goggles or face shield. PPE must be donned before entering the patient's room. Sequence for putting on personal protective equipment. Perform hand hygiene. Don isolation gown. Unfold the gown away from you. Place head through top opening, then put arms into the sleeves with the opening in the back. Wrap around behind you and tie the waist ties in the back. Don mask or respirator. You determine which is required based on the unit you are working on. For a tie-on surgical mask, secure upper ties at the crown of the head and lower ties at the neck. For an ear loop surgical mask, position the elastic bands around both ears. For both, extend the surgical mask to fully cover the mouth, nose, and chin. Fit the flexible band to your nose bridge. For an N95, hold the respirator in the palm of your dominant hand with straps facing the floor. Place the N95 respirator on your face, under your chin, covering your nose and mouth. While holding the respirator firmly in place, pull the top strap over your head and position it high on the back of your head. Then pull the bottom strap over your head and position it around your neck, below your ears. Using both hands, mold the nose piece using the pads of your fingers over the cheeks and bridge of your nose to obtain a tight seal. To perform a seal check, place both hands completely over the respirator. Take a few deep breaths and feel around the mask to ensure there is no air leaking out, indicating a good seal. A respirator such as a properly fitted N95 or PAPR should be worn if performing an aerosolizing procedure. If wearing an N95, it must be covered with either a full face shield or a surgical mask to help conserve the N95. Other options for covering an N95 include a PAPR hood if available. Don a type of protective eyewear. You can use goggles, full face shield, or a surgical mask with a face shield. Place over face and eyes and adjust to fit. Eyeglasses are not a substitute for eye protection. Don gloves. Extend to cover wrist of isolation gown. Ensure there is no skin exposed between the gown and the glove cuffs. You may now enter the room. Use safe work practices to protect yourself and limit the spread of contamination by keeping your hands away from your face. Limit surfaces touched and change gloves when torn or heavily contaminated. And remember to perform hand hygiene when appropriate. Doffing personal protective equipment. Here is a way to safely remove PPE without contaminating your clothing, skin, or mucous membranes with potentially infectious materials. Removing PPE should be a slow, meticulous process because your PPE is considered contaminated. Remember to perform hand hygiene between steps if hands become contaminated and immediately after removing all PPE. Remove PPE in an anteroom. If there is no anteroom, remove all PPE before exiting the patient room except for your mask or respirator and eye protection. Remove the mask or respirator after leaving the patient room and closing the door. Remove PPE in the following sequence. Gown and gloves. Grasp the gown in the front and pull away from your body so that the ties break, touching outside of gown only with gloved hands. While removing the gown, fold and roll the gown inside out into a bundle. As you are removing the gown, peel off your gloves at the same time, only touching the inside of the gloves and gown with your bare hands. Place the gown and gloves into a waste container. Perform hand hygiene. If no anteroom, exit the room at this time. Remove goggles or face shield from the back by lifting headband and without touching the front of the goggles or face shield. Place in a designated area to be cleaned. Both goggles and face shields are reusable and should be cleaned with a PDI wipe, purple, orange, or gray. Remove mask or respirator. To remove the tie-on surgical mask, unfasten the ties at the neck first. Then unfasten the ties at the crown of the head. For ear loop mask, hold both the ear loops and take off gently away from your face. Place in a waste container. To remove a N95, hold the respirator with your dominant hand to maintain position on face. Pull bottom strap over the head, still holding the respirator in position. Pull top strap over your head. Remove respirator from face and store in a brown paper bag. N95s are reusable for an entire shift, unless visibly soiled, damp, or damaged. Store the N95 in a clean, ventilated manner. Brown paper bag, ventilated storage bag, or vented clean plastic container. The bag or container should be labeled with the healthcare worker's name. Wash hands or use an alcohol-based hand sanitizer immediately after removing PPE. Please remember to help conserve your N95 for the UV process.